Hey, Jason, tell me a little bit about who put this thing together and how it's working out, and what's actually being done and what's going to be done.
So in collaboration with Commissioner Charlie Riley of Precinct 2 out here in Magnolia, County Judge's Office, Emergency Management, Meals on Wheels, and some community partners like Rita Wilkes with her group, and Summer and those folks at Meals on Wheels, we put together a senior program today where we can vaccinate as many seniors that are not capable of driving to one of the vaccine hubs that we have throughout the county. So we come out on site to them here at the West County Senior Center and give them vaccine while they're here picking up their meals from Meals on Wheels.
Quite a few coming through today?
We expect to do over 100 today. So.
How's it working out so far? You had the East County the other day, this one here.
It's very smooth. They both went very smooth without a hitch. The West and East County set up because they're community buildings that the commissioners have built over the years. They've got the same layouts, and it's very easy for a drive-up vaccine clinic for folks that are coming here already for the day for their meals.
Got a lot of people asking some of the elderly as far as signing up and how they're getting on lists and such. What's procedures now?
So Montgomery County OEM maintains the county-wide list right now. You can go to our website, mctx.org, and get to the emergency management page where you can get on the one list for everybody. We share that with all the vaccine providers partners that we have, whether it be Lone Star or the Public Health District, and we let them work through that list each week as they receive allocations. Right now, the demand for the shot is still very high, but the vaccine supply is still very low. So these lists are going to be long, and we're just asking for everyone's patience as we go through the list, as we prioritize from the oldest first down to those that qualify for health conditions, or as our first responders and healthcare workers as well. So
what's on the state level? How's it coming down? Are they bringing them down here?
So the state allocates to the providers. Montgomery County is not a shot provider. We have partnered with providers like Lone Star Family Health Center, the Public Health District is a provider. We have a vaccine site with St. Luke's. Those are providers who receive the shots from the state's supply, and through that partnership we're able to fulfill those orders and get people into the vaccine hubs to get a shot. So
now this is the first round. What about second round?
Second shots should be starting in the next week for the first group that went through our vaccine hub. They will be notified from the provider directly, but since the provider received a registration document from them, we have their contact info. They'll be told what day and where to go to receive their second shot. The second shots can occur anywhere from the 28th day from your first shot up to about 2 weeks after that 28th day. So be patient with it. State supplies are guaranteed for second shots, so getting that second shot is not going to be an issue. It's just a matter of the logistics of setting up the site and getting folks into it to get that shot.
Now, which shots are coming down, Moderna or the Pfizer?
Today we're doing Moderna. Pfizer is, most of our hospitals are having the Pfizer shots based on their capability to store that particular shot. The vial of the medicine, but Moderna is the one we're using here today with our partner at Lone Star Family Health.
Any word on the Johnson & Johnson yet?
It has been submitted for emergency use authorization, but it has not yet been approved to my knowledge.
Okay. If they get it approved, it'd be a little easier working with this single?
It'll be a one dose shot. It's a little less effective as Pfizer or Moderna, but not far enough down on the effective list to not be worth getting. And it's a one shot and finished, which is great for the logistics of setting up sites like this. And at the same time, it's made by a trusted company that folks have come to learn and use over the years, Johnson & Johnson. So it'll be a game changer for us. It'll be a third on the market. And from my understanding, Johnson & Johnson's already got stockpile supplies ready to roll out as soon as they get the authorization. Because they are producing it right now.
What about the numbers? Numbers so far, the COVID numbers for the county. How's it looking there?
So our spike from the holidays has come down. We are still seeing community spread. We are still seeing cases, but it is not increasing exponentially each day. They're actually decreasing. Our hospitalizations are decreasing right now due to people being away from each other. And as we continue to move on, we all know what we need to do as far as keeping our distance and wearing a mask if appropriate around groups and family and office settings, things like that. Keeping your hands washed and staying away from others. Staying home when you're sick is real important. Especially right now, you don't know if you're sick with allergies, sick with a cold because it's wintertime. It could be a flu or it could be COVID. So the best thing to do is when sick, stay home and get checked out.
All right. Okay, what about the rest of the county as far as sites set up? I know Wood Forest is going today.
Yeah, today we have Wood Forest.
Tell me a little about Wood Forest.
That partnership is between Herman Hospital and the Conroe Independent School District. They set that site up. Montgomery County has offered logistics support, and we have some law enforcement presence on site to make sure traffic control flows smooth. That's been a great opportunity for Herman and CISD to partner up on that project. they'll do close to 7,000 shots between today and tomorrow. Our other partners are St. Luke's Hospital. St. Luke's is ongoing today as well. They'll do over 1,000 shots on their site. That is a county and hospital partnership, and we will be continuing that partnership for as long as we get allocations from the state through that hospital. And then on Tuesday, earlier this week, we did our partnership site at the Montgomery County Fairgrounds with Lone Star Family Health Center, and we did a little over 1,700 shots in one day on that site, and we'll be repeating that one day next week once we get allocation in from the state. So.
All right.